most patients will start crying with joy, truly, when they look in the mirror. They haven't looked down and seen down there in a long time. I get to meet with all the patients first. I put together an entire, whatever plan is going to be best for them. I assess their body, I clear their med history, I go over pricing, payment plan options, and scheduling options. After that, there's come back for a pre-op with Dr. Zelko. He clears the case, he confirms the areas, and then we call in the medications for the procedure. After that, we see them again the day of their procedure. Jenny always reaches out the day before, 2 days before, just to go over all of their pre-op information, making sure they start their antibiotic, and really just answering any last minute questions. Once they come here the day of their procedure, Jenny takes them back to the procedure room. She has them change into a disposable bra and underwear. She'll get all of their before photos. Dr. Zelko comes in, draws out the entire area on them, making sure that they're going to get exactly what they want. They get them on the table, get them comfy, and they cleanse and numb everything completely. So once they're numb, he makes his entry points for the lipo, which are tiny. They're 2 millimeters, about the size of a piece of rice. Most common areas, abdomen and flanks. So he'll do 1, 2, 3, 4, 5, 6. Once they're made, he does go in with the cannula to put the numbing in, and then goes with the cannula to remove the fat. So that's the best part. I love the way the fat sounds coming out. It is immediate results. When you get off the table, it's off. We have it, and that's super important because when they get dressed, most patients will start crying with joy, truly, when they look in the mirror. They haven't looked down and seen down there in a long time.
And Dr. Zelko does an amazing job of making sure the patient is comfortable. He will go as fast as slow, so the patient controls the whole procedure. He will ask them 1,000,000 times, how are you doing? How are you feeling? And the patients always come back saying that made them feel so comfortable throughout the whole procedure, knowing that he was caring about how they were feeling, and it wasn't a rush, and he'll stop and give you more anesthetic. Like I said, take his time. And everybody appreciates that and says how wonderful he is and his bedside manner.
Truly,
really appreciate that.
Yeah, so afterwards we do send them home in a compression garment that we supply for them. They wear that between 1 to 2 weeks, and then we bring them back for post-ops at 1 week, 2 weeks, 1 month, 3 months, and 6 months. Dr. Zelko performs all of his own post-ops, which is important because he does stand behind his work at 6 months.